Welcome to class, students. Today, we'll be looking at a very important topic titled fractures. Introduction. A fracture refers to any break in the continuity of a bone. For example, most of us play games, most of us go to the field to play football, most of us like sports. We do one sport or the other, or we wanna go a training, exercise, and all those activities. So when there's a break in the continuity of a bone, it is called fracture. Sometimes it is mostly always painful. So these injuries can range from minor cracks to a complete breaks that can sometimes it even occurs while running. These injuries can range from a minor cracks to complete breaks that may cause significantly disability or in severe cases death if vital organs or arteries are affected. So cause of fracture, we have the direct cause first or the indirect cause. The direct force occurs at the exact site where severe force is applied. Direct force occurs at the exact site where severe force is applied. While examples are bullet injuries, falling onto projectile stones, wheels passing over bone. While indirect force occurs from the site where force is applied. Examples are collarbone fracture resulting from a fall on an outstretched hand. Types of fracture, we have the based on skin integrity. We have different types of fracture. Number one is based on skin integrity. We have the open fracture. The bone has punctured through the skin even if the bone ends are retracted and no longer visible. That is an example of open fracture. Then a closed fracture, the surrounding skin remains intact. And a complicated fracture involve damage to internal structures such as punctured lung or significant bleeding. Well, this is the open fracture, as you can see, the closed fracture, the incomplete fracture, the complete fracture, the displaced fracture, and the communi- comminuted fracture. Comminuted fracture. We have based on fracture pattern, we have the transverse, the oblique, the spiral, the comminuted, the impacted, the green stick, and the incomplete. So we take them one by one. The transverse break runs straight across the bone. That is an example of a transverse fracture. We have the oblique. Oblique break occurs at an angle across the bone. Then we have the spiral break twists around the bone. We have the comminuted bone shatters into multiple pieces. We have the impacted bone fragments are driven into each other, shortening the bone. While the green stick bone bends and cracks on one side, common in children. This green stick fracture is mostly common in children. We have the incomplete bone is not broken all the way through. While signs and symptoms, individual with fracture may experience one or more of the following. We have pain at the injury site. We have bleeding. The bleeding can be internal or external. We also have, okay, I said signs and symptoms. Individual with fractures may experience one or more of the following: pain at the injury site, like the person can be experiencing pain at this site at the point where injury occurred. We have bleeding. The bleeding, we've talked about the internal and external bleeding. The bleeding can be internal and the bleeding can be external. We have open wounds with or without exposed bone. It can also be as a result of deformity. Then shortening or rotation of the limb. Then we have inability to move or stand. Such as signs and symptoms. The person will be unable to stand or be struggling to stand or to move. Audible sound of the bone cracking. It can also occur, especially to footballers, people that like doing rigorous activity. So we have audible sound of the bone breaking. Tenderness of the bone, swelling or irregularity, signs of shock. Crepitus. Crepitus, that is grinding sound and sensation of the bone fragment. We also have discoloration and shortening of the affected limb, like the one leg will be shorter than the other. This all as a result of fracture. We have treatment of fractures. Initial management step: complete primary assessment following the DRSABCD protocol, so that's danger response, send for help, airway breathing, CPR and defibrillation. The DRSABCD protocol: D stands for danger, R stands for response, S stands for send for help, A stands for airway, B stands for breathing, C stands for CPR, then D stands for defibrillation. These are complete primary assessment following this DRSABCD protocol. That is treatment of fracture. Another one is ensure emergency medical service are contacted. You must don't forget the importance of having a local emergency number. That's a functional one that is in your within your community. Control external bleeding using direct pressure and elevation when possible. When to use, know when to use direct pressure, when to use elevation, when to just raise the hand up, like where the affected place, to elevate it up. For close fracture, apply ice packs to help with pain relief and reduce swelling. You can get a very cold substance or an ice pack to apply to the affected area to help to relieve pain and reduce swelling. Another is minimize unnecessary movement except for safety reasons. So you must don't stress your victim, or don't stress yourself if you are the victim. Ensure you minimize movement except for safety purpose. Then another one is immobilize injured limb using available materials like pillows, magazines or dressings. Check check circulation below the fracture site. Then perform secondary assessment. Then we assess the casualty condition and provide reassurance. So these are the treatment of fracture. Then look at the splitting techniques. Splitting techniques, well, figure 1 shows the elbow bent. These are another splitting techniques. Then another figure 2, humerus and elbow straight. Figure 3, the knee straight and tibia fibula. That is 5 bandages method. Everything is just to help to reduce and relieve pain. Then figure 4, hip, femur, knee, tibia fibula. That's 7 bandage method. Then the figure 5, knee bent. Figure 6, the ankle, and 7, the fingers. Splitting: improvised splint can be fashioned from cardboard or rolled newspaper magazine, umbrellas, rolled blankets, pillows. While the ideal splint characteristics should be wide and long enough to cover joints on both sides of the fracture, well padded for comfort, applied over clothing. Related injuries such as strain, sprain, dislocation. Strain, that is injury involving from tendons, while sprain injury involving from ligaments, and dislocation when a bone moves out of its original position. Never attempt to relocate a dislocated joint. Note that never attempt to relocate a dislocated joint. Physical assessment, that is PMS check. Always check for PMS, that is the pulse, motor ability and sensation before and after splitting. Pulse assessed by feeling appropriate artery, that is carotid or radial. Motor ability, check if casualty can move fingers or toes. Sensation, test by pinching or scratching palm or sole of the foot. Additional guidelines is when ensuring a caveat over the chest, ask conscious cas- casualty to avoid their breath, to hold their breath. For conscious casualty, place two fingers below the caveat on top of the chest before tying. Always maintain manual stabilization of holding the patient head firmly in a neutral inline position. Apply rigid cervical immobilization device when appropriate and permitted. Thank you for listening.